This patient is asking, my M spike keeps rising in spite of chemo. What can I do?
Very important question. Every patient must understand what their disease marker is. This patient is asking about the M spike, which is the monoclonal spike, whether it's in the blood or in the urine. And if the M spike is continuing to increase, and there is a significant increase, significant is defined by at least 25% from the nadir or from the bottommost point, with at least a absolute increase of 0.5 gram per deciliter, so half a gram per deciliter. So we want a 25% increase, but we also want at least 0.5 gram per deciliter. So if somebody had an M spike of 1 at their best point, then the increase to 1.5 is significant. If somebody had the M spike of 0.2, then it's not the 25% increase, it's the 0.5 that must happen. So they hit 0.7, and that's a significant increase. So that's how we think about M spike, 25% with an absolute of at least 0.5 gram per deciliter. If that is indeed happening, this would be considered a biochemical progression. And at that point, it should be considered to switch around the treatment, because we don't want the disease to grow to the point that there are actually symptoms showing up or organ damage happening. We want to be able to capture the disease progression sooner and act upon it.
Do you have any recommendations for people who, as we might have some patients watching this who are light chain only, any guidelines on if those numbers are rising?
That's an excellent question too. So if somebody has light chains as their marker, we are looking at an increase in the involved serum-free light chain. So if somebody has kappa as their marker, the kappa is going up, or if they have lambda as the marker, the lambda is going up. Typically, if both of them go up, that is not disease progression. That could be coming from kidney dysfunction. Somebody is dehydrated and they get labs checked, both kappa and lambda might be elevated. Again, a 25% increase in the absolute. But at the same time, we are also looking at least 10 milligram per deciliter change. So if somebody had a light chain of 2 milligram per deciliter, if it goes to 12, that might be a significant change. But I can say that light chains are a little bit more volatile and they do get affected by our fluid status. So if I ever notice a patient with a light chain increase, I'm more likely to repeat the test very soon, maybe even at a couple of days, 1 week interval, just to make sure that there is a trend rather than just a fluctuating light chain.
Okay, thank you for that information.
And I should maybe very quickly add, we do not check light chains in the urine. Light chains should be checked in the blood. Urine light chains are very non-specific and there's no need to test them.